case of cessation of breathing or a possible heart stoppage caused whatever life-threatening reason, it is important to assess the situation and correctly determine which basic life support technique will be required. Now, these can be any of the following: shock from violence, fireworks, lightning, poisoning. It could be epilepsy or seizures. It could be something like a car accident. It could be a coma that the dog is in. It could be a head injury. It could be electrical shock, for instance, or it could be just an obstruction in the airway or just choking on something like a ball or a piece of plastic or a toy maybe. The first assessment is whether the dog is breathing. So observe the chest. Does it rise and fall? Put your ear and cheek close to the nose and observe. Hear and feel for air against your own cheek.
So if you just saw that, we can see that this chest was moving up and down. So we have an open airway. Another quick way to check is to also put pressure on the chest at the same time feeling in front of the nostrils. So that way we can see, or actually feel, if there's air coming out. We can also put our face here.
What was observed when checking for air, either at the nostrils of the dog or alternatively in the chest movement? Now, if it was observed that there is air flowing, we can assume then that the dog is breathing. So then just pull the tongue clear from the airway, maybe check for something inside the throat. But if no air was coming, it is then basically a fact that the dog is not breathing. And the action then would be to feel for a pulse at the femoral artery located on the inside of the mid-thigh. If there is no pulse, immediately start with CPR.
So sometimes you're feeling it down here, what called femoral pulse, that's right on the back leg. Other times you're feeling the chest to see if you can feel the beat.
Hi, I'm Dr. Q with drqueston.com, and today I'm going to show you how to measure your dog's heartbeat. One of the ways that you can do that is actually to just put the flat of your hand right here on the dog's chest, right about the level of the armpit, and hold very still. A normal dog's heart rate is about 70 to 120 beats a minute, with 70 for the bigger dogs and 120 for the smaller dogs, and with some variety in there for excitement. But sometimes it can be tough to really feel it right here and see if you can tell what you're actually measuring. So in veterinary medicine, the best way for us to actually measure a heartbeat in a dog, if we don't have a stethoscope, is the femoral pulse, which is just right on the inside of the groin. So what I'm going to do is run my hand down her belly here. This is Sushi, my friend, who's going to help demonstrate. One hand down her back, and then I'm going to slip my full palms of my hands right down into the center of her thigh with my thumbs on the outside. And I'm going to just hold real still and feel for that pulsing femoral artery. This is a great place to feel a pulse on a dog. If you just are still and patient, you should be able to feel it. Hopefully between these two places, here on the side of the chest and here in the groin, you'll be able to get a heartbeat on your dog. I'm Dr. Q, and the rest is up to you. Thank you for watching today.
When you have to do artificial respiration on a dog, first of all, lay the dog on a flat surface with his right side down. Then also open his mouth and pull his tongue forward as far out as possible. Clear any secretions with a cloth, water, or a handkerchief around the snout, around the nose, around the mouth, and then also check and clear any foreign bodies inside the mouth that might be present. Check for broken teeth that might have been swallowed. And then also consider that it might be that the dog is just choking on something, which you can just pull from the throat or from the mouth if possible. And if it is impossible to do this, or it is impossible to even dislodge the jaws, confirm if circumstances may not allow for you to perform the Heimlich maneuver.
For a small dog, you would hold them upside down and you would gently shake them, holding them by their thighs, and gently shake them. Boo is clearly not a small dog, so for Boo, what we're trying to do is to get her into a position where gravity would help. So what we would do is we would hold behind her back legs and we put her in some sort of a wheelbarrow type position to see if gravity will help to dislodge that object. and you'd be looking to see if anything comes out. She could be coughing, she could be retching, she could be really struggling. The next thing that you can do is a Heimlich maneuver for animals. The way you do this is if you have a look down their chest, there is a natural gap after their ribs, and it's in that gap that you're going to put your hands. You're going to make a fist with one hand, and then you're going to put the thumb part of your fist up underneath her abdomen there, and with the other hand you're going to put it over the top, and from upwards you're going to push upwards towards her chest, and that will hopefully be dislodging the obstruction by doing that. You would do that up to 5 times.
So then look into your pet's mouth, right? I mean, open his mouth, have a good look inside. What's in there? Put your finger in the back. You need to sweep in the back of his throat. Is there a ball or something deep back in there? It's kind of the first thing you'd suspect. But can you feel something in there? And if you can suspect that, if it's something right there at the very base of his tongue, right here in the back of his throat, can you hook your index finger behind it and pull it out? I mean, that's your first big thing. Get that thing out of there if there's a little ball in there. But if it's sitting there back, and I had that experience in veterinary practice, I mean, where we knew there was a dog that came in choking, and we couldn't get that ball out by, doing a finger sweep. The next thing you're trying to do is, like, what's another way of getting it out? Is by doing a procedure called the Heimlich. Good boy, Jesse. And what the Heimlich is that we're putting force on your pet's diaphragm. We're putting force on the dog's diaphragm. Yes, we are, Jesse. We're putting force on his diaphragm, which is putting force in the back of his throat, with helping expel whatever's in the back of his throat. So the easiest way to do it in our pets is by using the force of gravity with them. So we're trying to put force in the back of the diaphragm. In us, it's just under our rib cage, as it is in our dogs. But we're going to do that by putting them upside down. I'm going to try it here on Jesse, see how it works. We might have to try it again. Then I'll also show you how you can do it if you're unable to lift your dog up. So with Jesse here, I would just I'm going to hold him upside down here. Good boy, Jesse. His back against my back. You're seeing his bum. And I'm going to, you see where my hands are locked together? That's right underneath behind his rib cage. I'm going to put 5 sharp thrusts. 1, 2, 3, 4, 5. A fair amount of force. And then I've also hung him upside down with gravity. Then I'm going to check his mouth. Is whatever is in there, does it come out? Sweep it. And I'm going to feel, is he breathing again? No. Then I'm going to also follow that up with at least 2 short breaths, putting my hand around his muzzle. Does his chest rise? If it doesn't, then I follow that up again and repeat that Heimlich. So if you have a big dog, he's too large for you to pick up, such as my bigger dog Lewis, who's 100 pounds, then you can try the Heimlich by having him on their side. And I want you to see if you can get your hand right around underneath their belly, though. Right, so if you see my right hand here, my left hand here, and I'm going to lock them together. So I've just got them up in here, just in behind their rib cage, in the top part of their stomach. You can feel those ribs. And I'm going to pull that in. I'm going to pull his stomach in my hands with my back up, my belly is right up against his backbone. And using that force, I'm going to pull in and up. I'm going to go 1, 2, 3, 4, 5. Yes. And in doing though, I've put quite a lot of force on his stomach, because you need to put a lot of force to then get additional force on his diaphragm, which then can potentially expel whatever's in the back of his throat. So that is the principle of performing the Heimlich.
Which is compressions or circulation. This needs to be done when the animal is still laying on their right side. For a small dog, a cat, or a large dog, the landmark is the same. You want to take their left arm and pull it back to their chest. Where the elbow meets the chest, it's usually the 3rd to the 5th rib space. You then want to remove the arm and place your hand over that area and place your hand on the other side of the chest. This is how you would initiate compressions on a large dog. On a small dog or a cat, you can just basically cup your hand in that same spot over the chest and squeeze.
There's 2 ways to do compressions in dogs. One is putting pressure right over the heart, and the other one is putting pressure at what we call the greatest width of the chest, which is just up from there. There's the heart, and here's the other place. Now, the difference between the two is based on anatomy of the dog, but the majority of dogs, you're going to do it at the point of the highest width or the largest width of the chest. And the way you're going to do it is just like you do it in people, and that is you'd have two hands on the chest and you'd be pushing down.
And I would say before even stepping up to your pet that needs CPR, two most important things: know an emergency veterinary hospital and have a friend that can take you there. Because it's more important to get your pet to the hospital than to try to do heroics at home.
When you need to perform CPR on a dog, as said before, first of all, place the dog on a flat surface, right side down. Then, position yourself behind the dog's back. Place your cupped hands on either side of the rib cage over the heart, immediately behind the point of the elbow. With puppies, use your thumb on either side of the chest and the rest of your fingers on the other side.
You can just usually put your hand right around the chest and then use your hands to do the chest compressions. It's a little bit easier, and you put your hand behind the back and the other one around the chest and just do the compressions that way, and then do the same thing.
When performing CPR, depending on the size of the animal, compress the chest approximately 2 to 4 centimeters for a count of 1, and then release it for a count of 1. Make sure to keep both elbows straight and push down firmly on the ribcage using your core strength, your back muscles and your stomach muscles. Do not use your arms and your elbows.
Okay. And you're going to lock your hands like this and basically compress down on the ribs, about 1 to 2 compressions a second. So you're going to do about 100 to 120 compressions a minute.
How do you know if you're pressing too hard?
Number one, you want to at least go a half to a third distance of the chest, and you want to let the chest recoil afterwards. You don't just want to keep going like that without letting it come back.
And so we're going to put our hands together right over the point of the highest, the thickest diameter of the chest, and we're going to push down about half to a third of the width of the chest. So it's a considerable amount. And that's how we're going to do it. We're going to keep our arms locked, we're going to keep our arms straight. We're not going to be doing it like this. We're going to actually keep it locked and use our core strength, our back, to get things moving. Moving 1, 2, 3, 4, 5, 6, keep going, 28, 29, 30. And then you take a break, you go to the nose, and you give 2 quick breaths. Both of them within, or lasting about a second. So you're going to do this, like so, and then you go back to the chest, okay? So that's the rhythm. What happens is that when you're doing this and you're getting a little bit tired, you're going to push down, but you're not going to get off the chest completely. And so because of that, there's going to be a little bit of residual pressure, and that's going to make the chest not fill or rebound as well as it should.
When you are performing CPR, and specifically when you are busy with the chest compressions, continue at a rate of 80 to 120 compressions per minute, which is about the rhythm of the song Staying Alive by the Bee Gees.
Going 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, and then immediately you go to the nose and do 2 breaths. And then go right back to it. So that's the technique.
While performing CPR, if you are just one person performing the CPR, administer a breath after every 5 compressions. With 2-person CPR, administer a breath after every 2 to 3 compressions.
You've got one person, you're going to be doing the chest, you're going to be moving to the nose. You're going to be doing the chest and back to the nose.